Hi, Dr. John Torres here with NBC News on this Facebook Live. I'm going to give you a couple headlines here that have been happening over the weekend and today, just to catch you up on things coronavirus. On top of that, I'd love to answer some questions you may have. So if you have any questions, please send them to us. We'll get to as many of those as we possibly can. But first off, let me talk about the headlines. Number one, the one that got the most attention yesterday was about a test for antibodies that a company called Roche is putting out. That one got emergency use authorization by the FDA. What that does is it says, hey, we think that the tests that you're giving us are valid enough to where we want you to go ahead and start using it with this authorization. This is not FDA approval. That's a completely different thing. That takes clinical trials and usually many years to get. This is an emergency use authorization, which is used in times of emergency like during the pandemic. And what it's saying is, you as a company tested this device, you gave us the results of the test, we believe them enough to where we want you to use them, but we'll be keeping a pretty close eye on you. Now what the FDA did today also is they came out with a statement, a policy saying, back in March, on March 16th, we did one of two things. We said either you need emergency use authorization, EUA, to go ahead and start using these, or even if you don't have the EUA, if in your own internal testing you found out that these tests were good enough, then you can go ahead and start using them. Well, today they came out with a policy saying that second part is no longer valid. When you come out with a device or a test, you need to get that emergency use authorization within 10 days before you can start using it. So they want them all under that EUA platform and umbrella. What they said today is there are now 12 tests, 12 antibody tests that are under that emergency use authorization umbrella. There are about 200 that they're looking at to see if they can include those as well. But for now, it's just 12 tests. Those tests, there's an Abbott test, there's a Roche test, there's a bunch of different ones. And you can go to different sites and find them. My best advice to you, if you're going somewhere to get an antibody test, talk to the clinic you're going to and saying, what test are you using and does it have the EUA, the emergency use authorization? If it does, then it's something you want to get, then certainly go ahead and get it. If it doesn't, say, I'm going to look elsewhere for one that has it, because that means it's been looked at a little harder. The other ones haven't. The other concern with the FDA, at one point, they said there were 150 tests out there that they really hadn't any idea of what those tests were doing or how well those tests were, so they were looking into it. The two main things they look for a test are something called sensitivity and specificity. Sensitivity means that if you have it, it's going to tell you that you have it. Sensitivity means that, that's sensitivity. Specificity means that if you're negative, it's going to tell you you're negative, which is a big distinction there. So they're looking at false positives and false negatives. They want the minimum amount of those possible. And these tests that they're giving the EUA for are very high. Some of them are 199.8% type sensitivity and specificity. The thing you have to remember about that, though, is a lot of these are on 4,000 people or so that they tested. So when they get tests, they get through FDA approval. But in the meanwhile, this EUA is the important part to look for. The second news item that came out is about a pediatric condition that they're starting to see in children in particular. I talked to one of the lead researchers on Friday, and she said it looked like there were about 100 children that had this condition so far, but they think there might be more. Other hospitals are reporting there might be more as well. And so this is one of those things, again, that although children seem to be protected from it and for the most part aren't getting affected nearly as much, especially as senior adults, children still can get affected. They need to be safe and kept safe from coronavirus because some of them are getting this, what they're calling the pediatric multi-system inflammatory syndrome, meaning that it's an inflammatory system in their body, so it seems like their immune system kind of goes into overdrive, is affecting different organs in their body, including their heart and other organs. And I actually interviewed a 12-year-old and her mother on Friday who went through this and ended up going into cardiac arrest. They did CPR and they brought her back. And so thankfully she's doing well. I interviewed her. She sounds fantastic. But you can imagine as a parent how scary that is for your child to go into cardiac arrest, their heart to stop, and have to have it restarted through CPR. Thank goodness she's doing well. But at the same time, this is one of those things that you have to remember. It's rare so far, but they're looking into it to see what they need to do, what's causing it, and how they can treat it. So let me go ahead and see now if you have any questions. But again, the two big things are, one, about the antibody tests. It's important that you look at that and make sure it has that emergency use authorization, EUA. And second is this condition called pediatric multi-system inflammatory syndrome, which can affect their heart out of all the other organs as well.
Are more kids affected by COVID-19 than we thought they were?
It's a great question because I talked about these kids. As of Friday, the number they knew was around 100. We think there might be more. So that doesn't sound like many kids, but the issue is we're finding out that kids are affected more by coronavirus than we thought they were a month or two ago. That means that their numbers are higher, and we kind of talked about this even a month or two. The more people that are affected by coronavirus, and now it's over 1 million people, the more numbers we're going to get of children who might not have been affected when the numbers were lower, but it looks like bigger amounts of numbers. And so there are going to be more children affected. More children are going to start getting these often rare issues like this pediatric multi-system inflammatory syndrome. But at the same time, you have to remember that all age groups are susceptible to coronavirus. Any age group could have issues with coronavirus, so you have to be very, very careful, and that means keeping everybody safe. Social distancing, that 6-foot distance, wearing masks when you're out and about. And I know some areas are opening up more and they're not mandating masks. If you can't social distance, let's say you're going to a grocery store, you're going to a pharmacy, you're going somewhere where you can't keep that 6-foot distance, it's advisable to wear a mask just to make sure that mask will protect you a little bit, but more importantly, it will protect other people from you, because we know that up to 50% of people don't have symptoms who do have coronavirus and could spread it to somebody else. So just issues we want to make sure that we're getting taken care of, because we don't want it to start spreading. We don't want those case numbers to go much higher than we know they're going to go anyway, and hopefully we keep it under control. Anything else?
Can you get COVID-19 from droplets in the eyes?
So the question is, can you get COVID-19 from droplets in the eyes? There's 3 ways COVID-19 can get in your body for the most part. Mouth, nose, and eyes. The mouth and the nose, it's a respiratory virus. So if somebody coughs and you're close to them and those respiratory droplets get into your mouth or your nose, it's going to get in there. It's going to start multiplying. It's going to get into your body. It can get into your eyes as well. The usual way it gets into your eye is because you touch a surface, you touch something, and after somebody else who had coronavirus touched it and got the virus on there, you touch it, before you wash your hands, you rub your eyes. Then it can get into your eyes. That's usually the way it happens, because if you think about it, when somebody coughs or sneezes, if they're close to you, you're going to close your eyes. You're going to blink, you're going to close your eyes. Less likely to get in that way. It still can theoretically, but it's more likely to get in if you don't wash your hands after touching something where somebody before you who had coronavirus ended up touching it. That's why it's so important to make sure you wash your hands for that 20 seconds and don't touch your face during the day any more than you normally have to, because again, that's an avenue for getting into your body. But that's a fantastic question.
This was from the last Facebook Live, but can you talk about the Oxford vaccine?
So we had a question from Facebook Live a while ago that I want to make sure we addressed, because I've gotten this question a few times. We talked about vaccines and how back in February, Dr. Fauci and other experts are saying 12 to 18 months before we get a vaccine. So we're talking February plus of 2021. So that's still a ways off. We know the coronavirus is going to probably come back in the fall, and so it'd be nice to have a vaccine beforehand. Well, some institutes like Oxford, they're using a different technique for getting that vaccine developed. They're using more of a genetic technique to develop it, which is new, and what they're saying is, we think we can get it done by September. But a lot of experts are skeptical, saying, proof's in the pudding. Let's see what happens here, because we don't think you can get it that fast. There are many, many, many industries, companies, manufacturing facilities, universities that are all trying to develop coronavirus vaccines right now. It's a big race. What they did say is going to happen is, instead of the normal 3 phases we go through to develop vaccines and get them approved, usually what happens is we go through 3 phases. At the end of the 3rd phase, if it's approved, then they start manufacturing it. Manufacturing itself takes time to spin up, and so that can add months as well. The reason companies typically don't like to do that is because if they manufacture it early on and it doesn't pass phase 3, then guess what? They just wasted all that money manufacturing that virus. But in this case, the government's going to step in, according to Dr. Fauci, and they're going to say, if we have a promising vaccine at the end of phase 2, before it goes into phase 3, we're going to ramp up the production process. We know, and he said this, we know we might end up just wasting that vaccine and wasting that money, but we'd rather do that so that once it clears phase 3, we're ready to go, than to have to wait months and months and months more after it clears phase 3. So again, they're going to look at the promising vaccine. They're going to say, this is something we think is good. Let's go ahead and start manufacturing it. Might even be multiple vaccines they're looking at manufacturing, and then get the most promising candidate at the end of phase 3 to get it out there. So once phase 3 is done, hopefully by February of next year, we have that vaccine ready, because that is going to be the game changer for all this. That's the thing that's going to get this under control. So let me see. Any other questions?
What about a report that nicotine blocks the virus? Can you talk about that?
So there's a big report out there that nicotine can help block the virus. Now, there's been a lot of concern and a lot of conversation in the medical community about how much we want to talk about this, because part of the concern is, number one, this was a small study done and people saw this and said, oh my gosh, if I have nicotine, I can be protected from the virus. We don't know if that's necessarily true. In this small study, it looked possible, but we've had many, many small studies that looked possible and they didn't pan out. So you have to be very careful with that. On top of that, nicotine is a very, very addictive substance. So if you start putting nicotine patches on or taking nicotine gum or lozenges, you could get addicted to it very quickly, which means you have to try and break that nicotine habit. We know when people are addicted to nicotine, they often go on to smoke cigarettes or vape. Those devices that we know can really harm your health. And so you have to be very, very careful with this. I would not encourage anyone at this point to try nicotine to avoid getting coronavirus or its complications, because number one, we simply don't know if that's true. And number two, nicotine, very addictive substance that could then lead to smoking or vaping, which we know can cause immense harm to your body. So be careful with that.
There are so many different kinds of tests. Would it be helpful for us to get each kind of test?
So the question is, there are so many different kinds of tests. Would it be helpful to get each kind of test? There are actually only two different kinds of tests. One is a test for COVID-19. That's the test for the active disease. There's three ways it's being done right now. One is nasal swab, throat swab is number two, or saliva is number three. All those tests seem to be equally good at determining whether you have an active case of COVID-19. In other words, you have the disease right now. Once you recover from that, your body builds up antibodies, and that's a second type of test. That's the antibody test. Usually after you recover, it takes a couple weeks to develop the kind of antibodies these tests are looking for. And so you can't get it. Let's say you recover from coronavirus 2 days ago, you get the antibody test today. It might be negative. So again, getting it 2 weeks from now gives you more chance of it being positive, 4 weeks even better so. That test tells us on a community basis, on a public health perspective, how many people in the community might have had it that we missed. Because again, remember, up to 50% of people with coronavirus don't show symptoms at all. And so what they're looking at doing this community-wide, region-wide, to try and find out how many numbers of people had coronavirus and whether it's spreading or being more under control. Now, as far as people using it for themselves, I usually tell people, if you want it on a personal basis because you think you were sick back in March and you just really want to know whether you had it or not, then getting it might give you some answers. But you can't get this antibody test and say, I have antibodies, the test said so I don't need to protect myself. I can go out there, I don't need to social distance, I don't need to wear a face mask. We do not know what having antibodies means. We don't know, number one, if it gives you immunity. We think it does. We don't know if it gives you full immunity. We don't know how long that immunity lasts for. And we don't know what level of antibodies you need to get immunity. All these test them at different levels, and so we're not sure what level you need to get that immunity that we think you're going to have, and we're certainly not sure how long that immunity is going to last. So again, even if you're positive for antibodies, you still need to protect yourself and your community, much like you would be if you never got the test. But essentially, there's two types of tests. One is if you're sick right now to find out if it's coronavirus. If you're not sick right now, it's not a test you need to get. The other one is the antibody test. That tells you if you had it more than 2 weeks ago and you're now having the antibodies built up to it. So it gives you a little bit of peace of mind, but more importantly for public health perspectives, it gives the community an understanding of where it's spreading and how it's spreading. See if there's any other questions.
Is it true that taking lisinopril or other certain kind of medications cause more severe symptoms?
So the question is it true taking lisinopril or other medications cause more severe symptoms? There's been a couple medications that have been in the news. Actually, there have been a lot of medications that have been in the news as saying if you take this, it could cause more issues. None of those have panned out. Lisinopril is what's called an ACE inhibitor. What we do know is the coronavirus actually latches on to ACE receptors in your kidney particularly. The concern is if you took these ACE inhibitors, this lisinopril, these types of blood pressure medications, could it cause you to have more of those receptors? Means the virus could get in easier. They have done extensive studies, as extensive as they could for the last 3 or 4 months, and have found out that that does not pan out. There are no issues with taking blood pressure medications. There are issues if you stop them, so you have to be very, very careful with that. On top of that, a new study came out last week, so not a study, People came out last week saying, hey, it looks like if you take a certain cough medicine, dextromethorphan, DM, that could also cause you to have some issues if you get coronavirus. Again, nothing has shown that to be true. So you have to be very careful when you hear these things, because until science plays this out and finds out what's going on, you can't give it too much credence. Take it with a grain of salt. But again, don't touch your blood pressure medicine. Keep doing what you're doing without talking to your doctor, and don't worry about the other ones so much. The main thing to do, social distance, wearing masks, washing your hands, not touching your face. Prevention is the best thing you can do at this point still.
Does that mean it's okay to take ibuprofen?
And the other question is ibuprofen. That's another one of the medications I forgot about, because early on, this was a couple months ago, they also said it looked like if you took non-steroidal anti-inflammatories, ibuprofen being one of them, that would cause issues. Well, there was a study that came out a little while ago saying it actually looks like it might help if you have coronavirus. So again, these things are going back and forth. This is so new. We don't have a lot of input. We don't have a lot of information. But on the studies they've done, looking at people who took ibuprofen, who took non-steroidal anti-inflammatories, it doesn't look like they caused any issues. So I would not hesitate to take those at this point. If you are concerned, if you are worried about it, simply switching to acetaminophen, which is also called paracetamol, it can certainly help with your pains and your fevers as well. But again, I wouldn't be too worried about ibuprofen or other non-steroidal anti-inflammatories at this stage.
Dr. John, do you want to guess how long we're going to be affected by this virus?
So the question is, do I want to guess how long we'll be affected by this virus? I think we're going to be affected by this virus for years to come, and here's why. Because right now, if you look at it, if you compare it to SARS, SARS did not spread this quickly. SARS did not spread this distant throughout the entire country. This one has. It's basically caught on like wildfire and spread incredibly fast. So until we get the vaccine, until we get some innate immunity, we call it, until we get a buildup of some immunity, it's going to spread through our communities. And it might never go away. It might be like the flu that's here every season, and we have to deal with that every season. I don't think we're going to be at the stage we are right now, or even the stage we're going to be next season, because I think we're going to slowly get to the stage where it can be treated like the flu, especially if we get that vaccine, the all-important thing. But again, I think it's going to be here for a while, so I think we have to be ready for it to be here for a while, and that means looking at a new normal. Nobody knows what that is at this point, but keep your eye out, because I think we're going to find out here fairly soon in the next few months what that means, especially once it starts coming back. So again, remember a couple things. Antibody testing, make sure it has the emergency use authorization. And in kids, even though they don't get it as often, or they don't seem to suffer as severe consequences as adults, they can, particularly in some rare cases, have very, very severe issues and even die because of it. So you want to be careful with them as you would with anybody else. And the main thing to do is do everything we know that works: social distancing, wearing face masks. If your community says, hey, you can go ahead and go out in the open, and you can go ahead and go back and resume part of your normal life, but here's what you need to do. Make sure you're following that here's what you need to do part, because that's extremely important. But in the meanwhile, again, thank you. I hope you have a fantastic week. Stay healthy, and please stay safe. Thank you.